Is it done? Is it over for today? What's going on?
Joe, I'm just learning this as you are right now. The president apparently told the Washington Post that there will be no vote today. This is news to everyone here in the Capitol. House Republican leaders had planned on voting late this hour or the next hour on this health care bill. They were widely seen to be short on the votes. But they were planning to go ahead. The official announcement has not been made, but a senior Republican source telling me that House Republicans are meeting right now, 3:35, privately to discuss the next steps.
And just another headline here, House Speaker Paul Ryan will be speaking on health care at 4 p.m. as well. So this Republican meeting that's taking place is a lead up to the House Speaker addressing the issue of health care at 4 p.m. Sahil, we know that Speaker Ryan went to go speak to the president earlier today. Do we have any sense of what was discussed at that meeting?
What we're hearing is that he was essentially conveying to the president where things stand on the health care bill, and the widespread expectation is that they don't have the vote. They're bleeding moderates who are concerned that the bill has too deep cuts in the tax subsidies and has too steep cuts in Medicaid that harm their constituents. And the nail in the coffin for a number of moderates last night was that the Freedom Caucus demanded and received a new provision in the bill that repeals the essential health benefits, these 10 things that insurance companies are mandated to require, and they thought that would make the bill even worse. So they're bleeding moderates on one end, and they haven't won the conservatives all on the other end, because a number of them think this bill is too much like the Affordable Care Act, that it has too many taxes, subsidies, mandates, and penalties as well. So that's the state of play right now. They simply do not seem to have the votes, 216 or even 215, to pass this.
Sahil, obviously congressional leaders, Paul Ryan specifically, in the White House wanted to get this done, out of the way. They kind of set up some artificial deadlines, however. There's no particular reason that they can't come back and take another stab at this later, maybe after Trump gets some wins under his belt related to taxes, putting someone on the Supreme Court. Is there any reason to think maybe later in the year they'd have a better shot at passing this with more time and planning?
Joe, the short answer is no. The way things work in Congress is that if you try one major initiative and it fails and you can't put together the coalition, especially at the start of a presidency when you're supposed to have a honeymoon period and a lot of momentum, you tend not to come back to it later. Bill Clinton tried to pass health care in his first year, failed pretty spectacularly, and he never came back to it. So it's going to be extremely difficult to imagine a situation where the dynamics get better for House Republicans down the road when you get closer to an election, when the honeymoon period is more than over, especially after they've moved on and conceded that they can't get it done now. So it's really now or never. And by that, I don't mean they have to get it done today. Potentially, they could keep working at this. They could keep trying to move some votes and get it done either next week or sometime this spring, but that seems unlikely, and it seems like the president has made clear, based on what our sources say, Mick Mulvaney, the budget director, told Republicans last night, that he wants to move on to other issues, whether or not this gets done.
We have another headline, from the Washington Post, Trump saying he doesn't blame Paul Ryan. So there had been this question of who's to blame if this doesn't pass. Is this Ryan care? Is this Trump care? Is this an establishment failure? Going to be lots of blame to go around. But Trump officially saying he doesn't say this is Paul Ryan's fault.
So it's an interesting twist there, because there had been reporting indicating that the White House was ready to throw Paul Ryan kind of under the bus and make him the scapegoat here. Sahil, I want to ask you, Congressman Louis Gohmert had said that it made more political sense to keep Obamacare because a no vote means that we save Trump from a Democratic majority in 2019. If this passes, if the health care bill passes, then Obamacare stays because the Senate has so many issues with it. Is he alone in thinking that? Is he an outlier?
I think he is a bit of an outlier. I don't know that Congressman Gohmert's sentiments are among the majority here. It certainly is true that many Republicans are afraid that if this bill does pass and their constituents do feel the pain of not having all these subsidies and this, the ability to join Medicaid if they're low income, then yes, then there'll be blowback for there always is blowback for doing a major change to the healthcare system. You can ask the Democrats of 2009 and 2010 that was going to be certain. The question is whether that would outweigh the embarrassment and the setback of failing on their single biggest promise over the last 7 years and the biggest initiative out of the gate of a new presidency when they finally have control of all levers of government. Either way, it's going to be, either way there's some pain around the corner. The question is which was the biggest one, and there was a division as to, which would be more painful.